Hello. We're going to discuss trauma stress disorder, also known as post traumatic stress disorder, short term PTSD. It's a mental condition triggered by experiencing something like horrific in one's life, something like some type of abuse, in some cases, war, accidents, natural disasters, that causes people to have symptoms of memory flashes of the situation. And it causes them to withdraw, have moods, negative thoughts about the whole situation, and can very much disrupt their ability to have somewhat of a normal life. It puts a lot of restrictions on them because they're reliving the event or the situation that traumatized them often. A lot of the treatments that would be used for someone with trauma is CBT. Also, medications could be useful. In some instances, situations can trigger trauma, like the relived experience of trauma. And it can cause people to have quick intrusive thoughts and intrusive memories that come so fast that the person can almost be immobile, almost like they're having somewhat of a panic attack. They may avoid situations, their feelings, their emotions, try to hide it in other things, like could be sex, running away, drugs, alcohol, anything. They have negative thoughts that they think about themselves. They can be detached. They can feel guilty about the situation, blame themselves. How could I have done something differently? Why was I around? They can be hyper aroused in certain situations, very guarded, aggressive. A lot of these things mostly last for about a month after the incident, but in some cases they can go on longer. A lot of times people suffer with trauma because they don't have a lot of family support. Family members may not know enough about it or just don't want to deal with someone who is experiencing all of those symptoms. They may have family history of mental illness, and the people just are not equipped to deal with or give them the support that they need or interventions that they need to help them. As far as treatment, it would be trauma focused therapy, CBT, and a lot of things that can help them relearn ways to deal, a lot of skill building to help them deal with the traumatic events of their lives. A lot of talking about it and how we can handle it in different ways. So we have support groups, things that they can do for self-care to remind them that what happened to them is not the totality of who they are. It is just a part of their life where they can just kind of work through it and handle it a lot better than with the negative symptoms that they've been experiencing. It's within us to support them and to help them in any way that we can. The young lady that I'm talking and speaking about, she was experiencing a lot of this, and she would compensate that with using marijuana because they say marijuana is quote unquote supposed to be a treatment for PTSD. But because she also has some other related conditions, marijuana is not the best use of treatment for her. So she has other medications that she would use, anti-anxiety, antidepressants that she could use that was prescribed by her doctor along with therapy, CBT therapy. It has helped her, and she has come a long way in learning new ways to deal with her trauma and not fully just constantly letting it be like in the forefront of her life and guiding the way she reacts and deals with life. If you deal with somebody with trauma, you want to make sure that you are being empathetic and understanding and listening to them, and then offer them skills and things that they can learn to support themselves when they're not in therapy, or family members who are there for them. Offer them some skills that they could utilize to center or ground their family member or loved one. Thank you, and have a great day.